And like you mentioned, admins think that probe covers are a commodity and are all created equal. But in our experience with 32 years in business, we know probe covers are not created equal.
We're continuing our theme for this month, which is patient safety awareness. And today we're going to be covering an important yet sometimes overlooked topic when it comes to ultrasound infection control, and that is ultrasound probe covers. The question really is to sheath or not to sheath, as it's easy to be confused about the right time, when to use the probe cover, or what kind of cover you should even be using. Today we're joined by Samantha Polayes, who will be helping us demystify the concept of probe cover usage and some essential steps that we could take to enhance patient safety by using them. Samantha is the Director of Sales at Sheathing Technologies. She has been at the company for over 7 years, and so she has a wealth of knowledge on the topic of probe covers and sheathing in general. Samantha, thank you for being here.
Yeah, thank you so much for having me. I'm excited to talk with you about this.
So we know that probe covers act as a physical barrier to infection transmission, yet sometimes as clinicians, I'm sure it could be a little tricky or feel a little tricky as to know when exactly to use them. There's a range of materials available. There's sterile, non-sterile. If I disinfect, is it okay to not use the probe cover? There's usually questions like that. But before we get into those details, let's start with the fundamentals. Could you explain why an ultrasound probe cover is important in the context of patient safety?
Yeah, absolutely. I mean, that comes up a lot in our line of work. Ultrasound probe covers play a crucial role in ensuring patient safety because they elevate infection control standards by effectively preventing cross-contamination, and they simplify the cleaning and disinfecting of the ultrasound probes, which contributes to hygiene protocols at healthcare settings. They also align with regulatory guidance, reinforcing their importance in the healthcare setting as well. And the ultrasound probe cover is the easiest and the simplest way to prevent infections from spreading from one patient to the next, since they do, like you mentioned, create that physical barrier between the patient's skin and the ultrasound probe.
Right, exactly. I mean,
Mhm.
it's a really useful tool when you think
Yes.
about it to just be able to cover the probe. And I mean, you're not going to get bodily fluids and other soils maybe on the transducer. So important. Now, what are the potential risks, though, associated with not using them? So could you tell us a little bit about that? Because sometimes I think there's a bit of a skepticism about how important they are. Like, can I just, like I said, disinfect? If I'm disinfecting already, isn't
Mhm.
that enough? Could you tell us a little more about those risks that are there if you kind of just forego using the barrier when you should?
Yeah, there are many potential risks associated with not using an ultrasound probe cover during an ultrasound guided procedure. Just due to the electronics in the ultrasound probes, they're never able to be fully sterilized between procedures at all. And high level disinfectant is what's commonly used for higher risk exams. And I mean, it's good, but it's not 100%. And
Mm,
traveling from patient to patient to patient without sterilization, because you can't, and
mm,
without using a probe cover can cause a higher risk of transmitting bacteria and viruses, which can
right,
lead to healthcare associated infections, also known as HAIs, such as
right.
MRSA. I mean, the big ones
Mm,
are MRSA, C. diff,
yeah,
hepatitis B and C, HIV/AIDS, HPV during vaginal exams.
yeah.
And the real heroes are the healthcare providers. They are the ones always advocating for protection of their patients.
Mm.
And just due to the advancements in diagnosis and treatment with ultrasound, there are really easy ways to protect both the patient and the probe from coming into contact with those viruses and bacteria that unfortunately do exist in the clinical environment.
Exactly. So the risks are big just in the infection side alone. You mentioned some really big ones. C. diff,
Mm-hmm.
of course, is a really big one in the hospital environment, and also the HPV risk
Mm-hmm.
is very significant because these probes are used often in
Mm-hmm.
OBGYN offices. Of course, we have the
Yes.
transvaginal ultrasound probes,
Mm-hmm.
so the risk is definitely there. Not to mention, of course, what you talked about, the sensitive parts of the probe itself, not allowing
Yes.
for the sterilization. So it's a really big important, like it's an important point to make. Now, what are some of the common mistakes or misconceptions that you've witnessed though, maybe even among clinicians or administrators, when it comes to the usage of the ultrasound probe covers?
Yeah, let me tell you about some common misconceptions that we see. So
Mm,
number one, like I mentioned before, is that clinicians think that the probes are sterile because of the high level disinfectant that is used, therefore not needing to use a probe cover. That's a
right.
big one. As we know, high level disinfectant is a good first line of defense. However, it doesn't kill all the microorganisms that could be living on the probes. So you just need to be aware of that. The second misconception that we see is that clinicians and, like you mentioned, admins think that probe covers are a commodity and are all created equal.
Mm,
But in our experience with 32 years in business, we know probe covers are not created equal.
yeah.
Clinicians and administrators don't always consider the impact the probe cover can have on the overall patient experience. When patients aren't feeling well, they can be highly sensitive. Their threshold for pain is pretty much as low as it can be, and their
Yeah.
discomfort is really high. I mean, nobody wants to be in the hospital or a healthcare
Right.
settings. And when you're using a probe cover that has really rough edges, thick
Mm,
material, larger seams, it can cause lower quality images, which then the clinician needs to do a workaround by applying more pressure to the patient's skin or taking longer, which can make unnecessary discomfort for the patient. I mean, we had a sales call this morning with a clinician who called in who mentioned that their probe cover had really rough edges, was super uncomfortable for their patient. It also had extra material around the scanning surface, so it caused air gaps in their imaging, which
mm,
led to poor imaging quality.
right.
So we see that one on a daily basis. And you just got to remember that the ultrasound probe cover is coming into direct contact with patients. So you really want a material to look and feel similar to the skin, right? So that's
Right.
a polyurethane-based material, which is soft and smooth. Polyethylene-based material is usually pretty thick. If you think of a plastic bag, that's kind of what they feel like. You also want your probe covers to be as seamless as possible, so completely seamless, latex-free to make the most smoothest and most comfortable patient experience
Mm,
possible. And last, but definitely not least, is that clinicians are not always properly trained on the importance of using probe covers and the correct technique for the probe cover application, which can overlook minimizing infections and cross-contamination.
mm,
And these are just a few that we see. There's definitely
right.
more,
Right.
but these are the top hitters.
Yeah. No, I mean, it's part of the patient experience,
Mm-hmm.
when selecting the right probe cover and just some of the issues that you mentioned. I think sometimes the idea might be, well, let's just forego using the cover because, they're not good. But it's more so about picking the right cover, really,
Mm-hmm.
because there's a lot of options out there. And you're right, they're not all created equal. Not
Yes.
to mention that some materials are more elastic or more durable than others. And that,
Mm-hmm.
of course, is part of the quality and the manufacturing, plays a role in that. And the image quality. The image
Mm-hmm.
quality is something that I have also heard too from clinicians that, oh, we used some of these covers. We were using covers, but they were too thick or whatever
Mm-hmm.
it may be, and
Yes.
now it affects the image quality. We don't like them. That's
Mm-hmm.
also something that is a common theme, but it comes down to what you were saying. It's an awareness issue too,
Mm-hmm.
right? Sometimes it's that clinicians and admins are just not aware really of the total impact, which is
Yes.
why it's important to spread that message. Now, could you walk us through the essential steps of correctly using an ultrasound probe cover? What
Mm-hmm.
should clinicians be aware of? Because we're talking a lot about saying, okay, you should use them, use them, use them. But what are some practical steps that you would say this is what you have to know when you're going to
Yeah.
use a probe cover?
Yeah, and that's a great question as well, because we see incorrect steps being used for ultrasound probe covers, and that could lead to, again, the clinicians not wanting to use a product because they don't think it
Right.
works. So there are
Mhm.
definitely a few essential steps to correctly using the probe cover. And to start right off the bat, it's the cleaning and disinfectant of the ultrasound probe, according to
Mm.
your facility's protocols. So whether that's high or low level disinfection, and then you want to make sure it's dry before applying the probe cover.
Mhm.
The next is to select the proper size and shape of the ultrasound probe cover. And there's three criteria to look at. So you want to look at the patient you're performing it on, the ultrasound probe that you're using, and the procedure that you're performing. So the helpful tricks are to choose a probe cover for the size of the sterile or non-sterile field that you need, which could be anywhere from an 8-inch length probe cover or a 96-inch length probe cover, which covers the entire cord. And those are commonly used in operating rooms or interventional radiology suites. You always want to make sure there are no gaps or exposed areas where contamination could occur. The next is to apply your acoustic transmission agent to the probe or inside of the probe cover. That's just depending on clinical preference. And then if it's going to be a skin penetration or any type of sterile procedure, you want to make sure you apply the probe cover with an aseptic no-touch technique to maintain sterility. And then there's a second layer of acoustic transmission agent that is going to be applied to the patient's skin or outside of the probe cover. You'll perform your ultrasound procedure with the probe cover on the probe, and then dispose of the probe cover and clean the ultrasound probe according to your facility's guidelines, again, with high or low level disinfection. And those are the biggest ones that we've identified.
No, I mean, that's a fantastic breakdown. That
Mhm.
alone is already a guide I think that facilities can use. The way that you explained it was really easy to understand. So it's really not that hard when we break it down. It's just the implementation and the awareness. Now, could you elaborate a little on the different probe covers? Because any clinician or admin that has looked for probe
Mhm.
covers sees that there are literally a million options, especially from a lot of manufacturers, right? So could you just elaborate on what's out there? What are the options that they have, depending, of course, on their setting?
Yeah, there are, like you mentioned, a ton of different probe covers available. I mean, in our catalog, we have over 300 different options.
Hmm.
And that all stems from clinical preference and for specific procedures, from endocavity to general purpose, invasive, non-invasive, sterile, non-sterile, bulk, individually packaged, and specialty covers. So we have a ton of options to cover all of that wide range of
Hmm.
criteria. And some of the most common types are, of course, endocavity probe covers, which are designed for use inside body cavities, such as the vaginal or rectal area.
Right.
And then the next big, most common type, which covers almost the whole other range, is the general purpose covers, which are very versatile and are used for many different types of imaging scans. And like I mentioned before, when choosing a probe cover, you need to make sure it meets the criteria for the type of procedure you're performing. And that's where sterile and non-sterile come into play.
Mm.
Sterile probe covers are always individually wrapped, packaged, and sterilized to maintain their sterility until point of use. They're most commonly used in procedures with compromised skin integrity, a more invasive procedure when a patient is compromised, and this is all
Mm.
in order to reduce the risk of infection. And then
Right.
on the other hand, non-sterile probe covers are not always individually packaged and are
Mm.
not sterile. They're typically used in procedures where infection risk is much lower, such as scanning the organs from the outside of the body
Right.
to identify any issues. And then there's the specialty probe covers, such as the TEE cover, which is for the transesophageal echocardiogram procedures that go down the throat. And those are kitted specifically for that procedure and include extra components to accommodate. And of course, I could continue to go on and on and on about all of the different
Right.
types. I mean, that's why we have such a specialized sampling program to make sure that we can meet, that the clinician can
Mm.
meet their own needs, right? Because we want
Exactly.
ultimately them to choose which one will work out best.
Exactly, yeah. Well, I mean, I think that that's a good breakdown right there of the different types. It is dependent, of course, on the setting and the individual
Hmm.
needs of the facility and what's being
Hmm.
done, what type of exam or procedure is being done. Another question that I think we should tackle too is what have the advancements been? Because I think a lot of clinicians, when you think of a probe cover, you think, okay, this is just like something I wrap the transducer in. Like there's nothing, there's not a lot to it. Might be
Hmm.
what one thinks on the surface, but there have been advances, right? Could
Yes.
you tell us how these probe covers have evolved over time and where we're at now?
Yeah, probe covers have come a long, 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 long way in ensuring both patient safety and comfort. Today, they're made with improved materials, more durability, and user friendliness.
Mm,
But back in the 1980s and the 1990s, healthcare providers were often using non-lubricated, no reservoir tip latex condoms that they could
mm.
buy at the pharmacy, and they
Right.
would use them as makeshift probe covers because that's all that was available. But because latex allergies have increased dramatically through the years,
Mm,
nowadays most healthcare facilities steer clear of latex to better cater to patient needs, and they
right.
also have different options available, not just latex condoms.
Mm,
And then a significant step forward came in 2016 when the first and only FDA cleared viral barrier probe cover came out on the market. It's seamless and latex free. And this marked a breakthrough because it was a complete barrier to all bacteria and viruses, which was highlighting a dedication to providing top-notch patient care.
right. And I mean, that's fantastic. That's
Mhm.
something that could really make a difference. So we have come a long way to where we were
Yes.
at in the 80s and the 90s, for sure.
Yes.
Now, looking ahead to the future, what are some innovations in the world of probe covers that you yourself are seeing and that you think could even further enhance patient safety? Because the fight against HAIs continues, right? And so we have to keep doing whatever possible, whatever's at our disposal to fight them. What have you seen in this specific area?
Yeah, well, when we talk at our company about where we envision the world with ultrasound, we envision a world where all ultrasound probe covers are comfortable for the patients,
Mm,
provide high quality imaging and faster imaging, and are completely seamless to eliminate any risk of cross contamination. A completely seamless, latex-free viral barrier probe cover with that FDA clearance provides a total barrier to all bacteria and viruses, effectively eliminating any risk of HAIs related to ultrasound procedures.
wow.
So that's where we all want to be, and that's
Yeah.
where we envision ourselves. And I know we can
That
get there too.
Yes, yes,
Hmm.
it's possible. I think we're definitely on the way there. And I think even though there's still more awareness that needs to be created around this topic, we
Hmm.
have come a long way, and clinicians are being more aware. You have a lot of societies, ultrasound societies, that are
Hmm.
issuing statements related to infection control, and that includes, of course, probe covers. And that's important just to get the word out there so that clinicians are aware and
Hmm.
keeping patients as safe as possible. So that's really great to hear from you
Yeah.
what those innovations are. Yeah.
Yeah, and I'm really thankful for you guys putting ultrasound on the forefront. I mean, it definitely needs that magnifying glass that you guys are doing. So we really appreciate you promoting it and, making sure that people can find resources and tools. So thank you for doing that.
Thank you, thank you, and thank you for being here. Thank you for being here, for taking your time out of your busy schedule to talk to our audience. And I think what all the information you shared is of great value. So I hope that the viewers listen to it, share it with a colleague, as it could really be a help in creating the awareness that we have to create. So thank you, Samantha.
Agreed. And thank you as well.